I think most of the people know the people here today. From my far right, Linda Lacewell, Superintendent of the New York Department of Financial Services, and also on the Emergency Management Task Force that is handling this. The good Dr. Zucker, Melissa DeRosa, Secretary of the Governor, Beth Garvey, who is the special counsel to me. Let's give you an update on COVID-19. These are the new numbers. Westchester County is up 10. New York City is up, who are associated with people who test positive, right? People look at these numbers as almost a statistical representative sample of what's happening. That's not what this is. These are positive cases tested primarily from a universe of people connected with someone who tested positive. What they do show is a continuing problem in Westchester County. And it's not Westchester 8, New York City is at 36. I mean, that is really breathtaking. Again, putting things in focus, Washington State is at 179, New York at 173. You see how much higher the deaths are in Washington? That makes the point that we've been talking about, who will be most likely affected by this situation compared to New York with no deaths, right? Same number of cases, look how much higher Washington is, because it's about the senior citizens. And our focus governmentally, nursing homes, senior citizen congregate living, our focus on an individual level, senior citizens, compromised immune systems. Again, what is the net effect of the disease? People talk about it like it's the Ebola virus. In perspective is the Johns Hopkins tally, which has tallied all of the cases since China. 114,000 cases. That's China, that's South Korea, that's Italy, that's the United States. 4,000 deaths, again in the vulnerable population. 64,000 people recovered. 46,000 cases still pending, people getting treatment or people at home. That's the entirety of the universe. What we are going to do is focus on an area, concentric circle, around the situs of the majority of the cases in New Rochelle. Much of the transmission tends to happen on a geographic basis. Kids go to school, kids go to a store, parents go to a store, parents walk down the block, shake hands with someone, parent is walking the dog, meets somebody, says hello, which we have in the state right now. And coming up with a special strategy to deal with this has been his focus. He has recommended a plan to me. I have accepted the plan, which will deal with this containment area, and the commission will speak to it in a moment. One of the things we're doing is we're putting a satellite testing facility from Northwell into New Rochelle. So they will set up a facility within that containment area, cab to go to the hospital. Now you possibly affect the cab driver, somebody gets on a bus, now the person is on a bus. So this is a major advantage. We're also going to use the National Guard in the containment area to deliver food to homes, to help with the cleaning of public spaces. There is a debate about how, so cleaning those surfaces is very important, cleaning it with the right material, and the National Guard will be helpful on that. With that, let me turn it over to Dr. Zucker to talk about the strategy for New Rochelle.
Thank you, Governor. So as we know, this is an evolving situation, and we're addressing many different points as we move forward on this. We have spoken before about the issues of containment, and we have moved from a containment strategy to more of a mitigation strategy. When you're dealing with mitigation, you have to deal with the beginning of the Westchester and Rochelle outbreak, and we felt that a radius of a mile from that spot would be effective in an effort to try to decrease the spread. I spoke to some of the public health experts the other day and also this morning, all the time I should say, about this issue, and we have to remember that we are sitting with the first point on a curve, or first couple points on a curve, and it would be wonderful to be able to go in the future and look back and see how this curve is going to evolve, but we don't know that, and so the most important...
A 2-week period where facilities within that area, schools within that area would be closed for 2 weeks. We'll go in, we'll clean the schools, and assess the situation. This will be a period of disruption for the local community. I understand that. Local shop owners don't like the disruption. Nobody does. Local politicians don't like the disruption. I get it. This can't be a political decision. You tend to make a mistake. So again, the period is March 12th through the 25th. 1 mile is a fairly constrained area. It is a dramatic action, but it is the largest cluster in the country. And this is literally a matter of life and death. That's not an overly rhetorical statement. A couple of other facts. I've asked the controller of New York to stop. Tourism is down, hotel bookings are down, restaurants are down. So we just did the budget projection estimates. The world then changed since then, so I asked him for any advice that he might have. As I mentioned earlier, there are different opinions on how long the virus can live on hard surfaces. So much of this is new and evolving. No one really knows for sure, so you take their cleaning efforts. It's easy enough to clean. It's a question of bleach or another cleaner that's approved by the EPA that kills viruses. But if it is 2 days on a hard surface, a bus, et cetera, just pictures people are walking around, that is a different situation. And I want to make sure that the cleaning protocols are up to date. Again, as a point of, it must close, then you do an assessment, then you determine what to do with the school. And that will be done on a school-by-school basis because the facts change. And I think that's it. One other point of clarification. You cannot joke. Do not joke. Whenever you joke, you get in trouble. Hand sanitizer that we presented yesterday.
About New Rochelle, Scarsdale School, they had somebody test positive. Another local school had somebody test positive. So why, how far do you make that quarantine, and why, specifically New Rochelle? Obviously, that's where it emanated, but how broad do you make this quarantine?
So we looked at the area from the hotspot, if you want to call it that, and decided to go out 1 mile as a radius into the area, see what the encatchment area of mixing things between quarantine and closing. What we're saying is that we're going to close those schools, obviously clean the school, obviously try to break the spread of this disease. And if you look at it from a public health standpoint, you're trying to break one person infecting the next person, and they just keep going, and you go to the spot where the hot spot is, and that's what we're doing.
Is that the only thing that's going to happen in the containment area?
Excuse me a second. But Joe, you're fundamentally right. Look, you have people who say it shouldn't be 1 mile. It should be 2 miles. It should be 3 miles. Look at, you have the Scarsdale School. Extraordinary in this field. Let me just take a moment to say, I talk to people at the World Health Organization, NIH, Dr. Fauci, who's one of the international best. They all say to me, you have the best with Howard Zucker. They all say it. He's been in Washington. Everybody knows him. And I'll tell you the truth, it's given me such comfort because he is nationally reputed as really an expert in this area. Our public buildings, I don't know if they're large social gatherings.
everything within that mile shut down?
No, not everything, just large facilities that do large gatherings.
And we're, sorry, excuse me, and we're working directly with the mayor and the county executive to identify a list that we all agree on, but as the governor said, it's focused on the major congregate areas, not all businesses.
So people can go back and forth to their homes and businesses will remain open, or?
Yeah, it's large congregate facilities or.
Girls Club that was on the list they asked us to consider, so things like that.
The point in the middle of that 1 mile.
We'll get you the exact list after this, but it's the school, it's not the entire New Rochelle School District, it's the schools within that 1 mile radius.
Yeah, it is no school system. It's a geographic concept. So it's whatever school, public, private, is in that 1 mile area.
Quarantine within that?
No.
No, so you're just saying,
Well, it's facilities. I don't think anyone is going to violate it. You know, you're talking about a school, primarily schools, any large congregate gathering place that would be operating in the next 2 weeks. I don't know if they're planning any concerts, any conventions, or whatever.
So does that include like the upper schools of the New Rochelle public system? Because if that's the case, or if it's not the case, then a kid from the containment zone is going to the high school out of the containment zone.
Yeah,
After this, that fall within that 1 mile radius. And then the other schools that we're talking to is SAR Academy, the Westchester Day School, the Westchester Torah Academy, so the other schools that have already been impacted by this because the population is in that base center.
Scarsdale closed down. They're
On their own.
outside of the area.
Yeah.
they closed down on their own.
You can't say what the pinpoint is. You know, you've got a 1 mile circle. What's the pinpoint?
It's the center of the cluster.
An address, a building.
Oh, I don't know, but it's whatever's in the middle of that 1 mile.
Part of the city is this? East side, west side?
I don't know, more than double the number of cases of New York City. I mean, it is true. It's a phenomenon.
So is there a thought that you could use this as a way to contain it in other parts of the state if, as we start to see?
Well, that's
more-
basically what you're doing across the country, right? We close schools, right? That's what everyone's doing, is closing schools. What does it mean when you close a school? You're closing the large gathering area in that community. That's what you're doing. You're closing colleges. Why?
Possibility of being used elsewhere or even statewide at some
We don't have any, I haven't heard of anything else like this anywhere.
Do you have any information on more about Rick Cotton and how he actually contracted coronavirus?
No. He is doing well. Did you speak with him today?
Last night, he's doing well.
You spoke with him last night? I spoke with him
He's
yesterday.
asymptomatic, he's home, he's doing fine.
We just seen a report that it wasn't at an airport, that it was a separate person he came into contact with on Friday.
I don't know.
This goes back to the issue of community spread and what we've been speaking.
Expanding the inspection protocols.
It's been working on a vaccine. Are there other local companies that have been also working on a vaccine?
Can you start that again?
Regeneron is working on a vaccine right now. Are there other local companies in the state working on a vaccine as well?
I don't know. Maybe Dr. Zucker knows. Regeneron is a great company. They've done a lot of groundbreaking work. We do a lot of them with the state. The Regeneron started with an economic development grant. Exploded, went crazy. New York State sold the stock somewhere along the way, made a lot of money. Not as much money as if they had kept the stock, because the stock has continued to go up. So Regeneron was born from New York, and now it's just a multinational company. But I know they're working on it. I know other companies are working on it also. You have to develop the vaccine, and then you have to go through the testing protocol.
Company, I think, has one too. Should they reconsider holding these parades?
You know, Nick, you have to look at the specifics here. You look at the map of the state. You have very few cases in some area, and you have larger numbers in other areas, and then you have critical numbers like New Rochelle. So you have to calibrate it to the place. You know, this is such a different situation in different parts of the state.
Healthcare workers that work with.
Let's take one more.
Assist with childcare. I mean, we have thousands now.
Very closely with our long-term care facilities to address that. Yesterday, we mentioned that no visitors to certain nursing homes, and we're also pushing back on the number of people who can visit, and being very aggressive on making sure that anyone who's sick is identified.
Should all healthcare workers be tested if they work with patients directly?
Help with food delivery, transportation services.